Selamat siang Bapak-Bapak, Ibu-Ibu, Saudara-saudara, dan teman. Nama saya Eric, kita dari Melbourne, Australia. Terima kasih untuk undangan dari Ibu Astrid untuk bisa bersharing dan berbicara bersama. Pertama, saya mau mengcongratulate Playhouse Academy untuk anniversary yang kedua. Saya juga mau berterima kasih karena Ibu Astrid sudah baik mengundang saya untuk bisa berbicara mengenai COVID dan anak-anak. Nama saya Eric, saya adalah brother dari Ibu Astrid. Boleh ditebak siapa yang lebih tua. Saya sekarang tinggal di Melbourne, makanya saya mau mohon maaf. Bahasa Indonesia saya sudah kayak rojak. Kalau bisa saya akan berbicara bahasa Inggris. My name is Eric Levi. I'm an ear, nose and throat, head and neck surgeon. I work at Royal Melbourne Royal Children's Hospital and at St.Vincent Hospital in Melbourne. I work as a specialist in pediatric and adult head and neck surgery. And I would like to introduce as well Ibu Dokter yang cantik, Dr. Kate Lim, ahli di bidang di infectious disease. Ibu Kate Lim atau Dr. Kate Lim, panggilnya apa, Bu?
Hi everyone, I'm Dr. Kate Lim, and I'm also part of the Levi family because I'm very lucky to be married to Dr. Eric Levi. And I am an infectious diseases physician, which means I look after patients with severe infections. So the last 2 years have been quite busy for me with COVID, and I work in a number of hospitals here in Melbourne. Eric and I have 3 children, so this topic of COVID and kids is something very close to our hearts.
So today we would like to talk about COVID and children, but we really would like to begin by saying that we appreciate that this topic is a very painful topic and a difficult topic for a lot of people. All across the world, millions of us have been directly and indirectly affected or impacted by COVID. We've been in fact impacted in indirect ways, for example, loss of business and school closures and restrictions to our activities. But many of us, especially in Indonesia, has been affected directly by loss of loved ones. I'm sure you know many friends and families who have died because of COVID. And we respect that and we honor that, and we honor the fact that this is still a very difficult conversation for a lot of people. But in your session today, as the learning and teaching and education training session for teachers and also for parents, we would like to look forward and see what can we do for our families, for our children, and for our schools in this context of COVID. And so we're going to go straight. Let's talk about COVID in children. Now, Dr. Kate Lim, the last 2 years have been very difficult and challenging for us. What's COVID like in 2020, and why is it different today in March 2022?
Yeah, I think the last 2 years have felt very long, actually. In some ways, a lot have changed, but in some ways, things hasn't changed as well. For example, we're still in the middle of the pandemic, and for many, it feels like we're not sure when this is going to end, if it's going to end. 2 years ago, we had no idea what this virus was, and we had no vaccines, no treatments. So we've come a long way. But then comes the variants, and each time a new variant comes, it throws new surprises. Last year was Delta, and now we're in the midst of Omicron variant. But I would say really the biggest difference now compared to 2 years ago is that we have safe and effective vaccines available.
Mm. Yeah, I still remember back in 2020 when I thought that this was going to be just 1 year of being at home, and then we're going to go out in 2021 and we're going to visit Astrid and her family. And here we are 2 years later, we still haven't seen each other. We have not been reunited with our relatives back in Indonesia. It's been difficult, and you're right. It's all of this various variants that has arisen, and it has been changing our plans and strategies. But you're right, isn't it? Vaccine is one of the most amazing things that has occurred in the last 2 years. So does the vaccine work?
Yes, it does. And for me personally, that's what gives me hope that, this pandemic will eventually end. And so, yeah, and we have more than one vaccine available, and we're starting to roll it out to younger and younger children. And I understand that in Indonesia too, that they have started rolling out to children 6 years old and above. Here in Australia, we started a couple of months ago for the 5 to 11-year-olds. So our 2 younger children have now been fully vaccinated, which I'm very happy about.
Mm-hmm. And so the disease profile itself, now that we have the vaccine, has the disease profile changed? Has it affected us differently now in 2022?
Yeah, well, each variant has been different. Certainly, we know that the vaccine works in terms of reducing the severity of illness. So you can still catch COVID, you still can get infected, but especially for those who are vaccinated, and I see that it's very obvious difference in the hospital. Those who get vaccinated, who are vaccinated, don't get a severe disease. So we know that Omicron is a bit milder, but at the same time, it's also more contagious. So that's why it's spreading so fast. And even though we've got vaccination, that there's still a lot of people who are getting COVID. But the most important thing to remember is that the vaccine does reduce your chances of getting severe disease. And those who get vaccinated tend to clear the infection quicker as well. So that also then reduces your period of being contagious, and so that reduces the spread of the infection.
So those are very powerful points that I just wanted to pick out. That the vaccine reduces transmission, the vaccine reduces the severity of the illness, and which means that even if you did unfortunately catch the virus, hopefully with a vaccine in your system, that the severe illness is significantly reduced. Is that correct?
Yeah, that's right. And I think it's become increasingly obvious now that we're not going to be able to get rid of COVID completely. So it's going to be a virus that's going to be around for a long time. But if we can, with vaccination and with immunity, be able to make it a less severe disease, then it's something that we can live with, and we can start going about our normal life without having to be, so fearful of catching it.
So, doctor, this is the hard question. Which is the best vaccine for my children, doctor? What would you say to that?
Well, actually, it's become increasingly hard when you've got sort of more choices, but and we have different vaccines here in Australia than in Indonesia. And when the vaccines first came out and available, there were people who asked, should I wait for the better vaccine? Which is the better vaccine? And our advice has always been, the best vaccine is the one that you can get into your arm right now. So whatever you can get that will give you good protection, and whatever your government is supplying you right now, the vaccines are all safe and they're good.
I agree. I mean, knowing that my grandmother, who is in Jakarta now, who is in her, over 97 years old and has the vaccine, really has put a lot of relief on my heart as well. And so the other important thing is I know that kids under the age of 5 or under the age of 6 in Indonesia are still not eligible for vaccination. Should we be thinking about vaccination in that age group, or does the fact that the adults are getting vaccinated actually protects the children? What do you think, Dr. Lim?
Yeah, look, we certainly in quite a lot of countries, there's research going on vaccinating the younger kids. So we will know in a few months' time what is the best dose and what vaccines are safe. You know, when it comes to little children, as parents, we are always, that's the first thing that we are worried about, is in terms of the safety of the vaccine. So we're still waiting for more data, but it won't be long. In a few months' time, I think we'll start to see it being rolled out to younger children. Now, what can we do in the meantime? I guess that's the biggest question. And definitely, as an adult, the best thing you can do for your child is getting vaccinated yourself. And we do know that as time goes on, your immunity actually drops as well. So if you're due for your booster, so if you've only had 2 doses, we actually do recommend that you get a booster, and that will bring your immunity right up again. So as adults, the best way you can protect your child is to get vaccinated, and if you have only had 2 doses, to get your booster.
That's good to know. Now, for all of you listening and sitting in, we are going to be live to answer your questions after this recorded session. So just stay back, hold your questions, and please ask the easy questions to me and the hard questions to Dr. Lim. Now, next, is it only vaccine? Should we just get vaccinated and then go back to our daily life? What do you think? Well, especially right now, there's a lot of people sitting who have schools, who are teachers, who look after lots of children. What do you think, Dr. Lim?
Yeah, vaccination is just one strategy, and I would say it's the most important strategy, but it's not the only one. Now, this is a respiratory virus, which means that it's a virus that enters and lives in the respiratory tract, and that includes your nose, your throat, your airways, and that's how it spreads as well when you come into close contact with someone. And now we know that it actually does hang around in the air a bit as well. So having mask, a good well-fitting mask is really important. So we would encourage everyone to be wearing masks when you are in a close environment, when you're coming up close to someone and you can't sort of physically distance, or in a crowded place. I know in Indonesia there are a lot of crowded places, and places where there's no good ventilation. So ventilation is really important. By ventilation means sort of air movement. So if you're in a place where you're able to open up the windows, having good airflow, that's really important. And I guess a lot of parents, this is one of the most common questions parents ask is there anything I can do to improve the immune system of my child? And really, our children actually do have good immune system already. And as Asians, especially, we like to ask what kind of food should I eat or what should I not eat? And what my advice always is that actually if you just have a good, well-balanced diet, that diet itself actually will give you all the nutrients and vitamins you need. You don't actually need extra vitamins or supplements. So don't worry about spending lots of money on extra vitamin and supplements. Just train your children to eat a good, well-balanced diet. So these are all basic things that we already know. But I would say too that a lot of our kids nowadays, they're quite addicted to screens. This I'm talking about our own children as well. So actually, another part of having a healthy body is really good physical exercise and making sure that they have time engaging in physical exercise and spending time outdoors too. This is something we emphasize here a lot in Australia. I know it's a bit harder in Jakarta when it's hot and it's sweaty, and sometimes as Asians we don't like to go out in the sun much, but actually time outdoors, time in the sun, that's a really good source of vitamin D, which is very important for your immune system. So good diet, exercise, just the basic things that's good enough to give your children a good immune system.
That's good to hear, because Ibu Astrid is a runner, so she runs a lot, and she would run faster than you and me, or even than her husband, I think. But I think it's
a great
good
role model. Yeah,
it is a good role model indeed, and it's what's important as well. You've mentioned that this is a respiratory airborne virus, so it's almost as if you need to think of it like glitter and powder. And, you work with a lot of children. The listeners, people who listens to us at the moment, work with a lot of children. So they know that when somebody spills their glitter or spills powder, almost the whole class has got glitter and powder everywhere. Air conditioning, ventilation. So in Australia, we talk a lot about opening our windows as well to try and allow as much air to circulate around the room, using air purifiers or filters that are safe as well. That is a possibility. So vaccine is the centerpiece, but also there's a lot of other things such as masking, distancing, air ventilation, air purifiers, and making sure that there's good outdoor air flowing. And then with regard to your immune system, keeping yourself healthy with good food and good exercise. So those are a lot of things that we can do. So we don't have to fully rely on one particular government strategy or anything like that. Now, in the last 2 years as well, we've noticed that COVID has had a lot of effect on children. What do you think? What's been affecting, what's been the effect of COVID on children, Dr. Lim?
Actually, can I ask you that question, because you've been asking me a lot of questions, because Eric, you work in a children's hospital. So tell us what you've been seeing and what kind of impact COVID has had on children. Yeah.
So I work at the Royal Children's Hospital, and I'm also with Melbourne Children's Research, Murdoch Children's Research Institute, which is a big research institute in Melbourne, just beside the Royal Children's Hospital. And we do a lot of research around COVID and kids. And you can search this on the internet. There are reports after reports after reports. And unfortunately, just like COVID has affected adults, COVID has affected children very significantly as well. And it has affected children in ways that is different to adults. We can talk about the physical, we can talk about the educational, we can talk about the psychology. Talk about the physical, for example. COVID has affected kids in the sense that a lot of kids are now staying at home, staying indoors. There's a reduction of physical activity, and there's a lot more dependency on screens, iPads, iPhones, tablets, televisions, videos, Netflix, and all of that. Now, that has impacted kids in a very ubiquitous way, in the sense that most kids are now becoming really dependent. It has affected their focus. It has affected their sleep. There's intrusion of sleep. So if there's anything that I would like to bring out, please think about, and we go back to that initial question, think about being outdoors. Think about family activities that does not involve screens. Think about physical activities that would improve their sense of physical well-being. And their physical well-being is connected to their social well-being as well. Of course, particularly children, they need companies. They need to socialize with other children. And the studies have shown that up to about 30% of children have got some sort of anxiety or depressive or mental health disorder due to COVID. Now, we also understand that there's a real balance. There's significant mental health challenges when you've had so many people in your community pass away of COVID. But there's also significant mental health issues when children are in lockdown situation. They're at home, they don't go to school. So that also carries a significant challenge. Significant amounts of young adults, adolescent, pre-teenagers, and even young children are manifesting mental health challenges or mental health illnesses because of the reduction in social contact. So we need to try and bring children back into that village. You know this, it takes a village to raise a child. You are childhood educators, so you know exactly what we're talking about here, the importance of social engagement for children's development. So we need to think about that. And also from an educational point of view as well. Of course, in Australia, we have been measuring the performance of children. And although in some levels, some children do better with virtual classrooms or online learning, many children don't do as well. And again, all virtual learning is not going to be good. All physical learning might also be challenging because you do need a little bit of combination of both when it comes to safety and also educational engagement. And I think this is where you've got places like Playhouse Academy or many other schools that have adapted their approach to education. And I think it's a powerful thing that all of us in the education industry and health industry learn to adapt our approach to children to make sure that they are getting a physical, a social, and also a cognitive or an educational input that is appropriate and safe. There's a lot of research around there, and you can find them on the internet. But my biggest plea to you is essentially to think that the child needs to grow in an environment that is safe physically, of course, from COVID, but also safe emotionally, mentally, physically, spiritually, and in all sense, we need to adapt our approach. Does that answer your question, Dr. Lim?
Yes, it does. I think, we as parents ourselves, we have had that same dilemma in terms of as doctors, we understand that health in children is not just physical health, it's their mental health, their emotional well-being, their social, how well they interact with others, their peers. And school actually is such an important environment for them to be in. And so when you take them out of school, we really see the impact of that. So now our kids are back to school, and we're really glad that they are learning and thriving. But at the same time, we acknowledge as parents that we worry about them bringing the virus home as well. So it's that balance, but we know that our schools are doing their best, and I know Playhouse Academy is doing its best to provide a safe environment for the children. And seeing our children back in school now has been really good for everyone in the family.
I agree, and I think this comes to our last point, which is the role of schools and COVID. And I know that there's a lot of parents who would want to protect their children by keeping them in a bubble at home, but at the same time knowing that that is also not necessarily helpful for their children's development. What can schools do, or what can educators do in this world of COVID to be good educators? What do you think, Dr. Lim?
Well, my first message is always vaccination. So definitely, here in Melbourne, we do say that every educator will have to be vaccinated. But also we do have a system where we have regular screening and testing. So here we use antigen tests. So the teachers and the students will do antigen tests twice a week. And in our school environment, again, we encourage time spent outdoors, and we have HEPA filters installed in every classroom. And Playhouse Academy has got HEPA filters as well. So these are air purifiers that might just help with the airflow and purifying the air environment. It's not 100%, but these are all strategies when put together will help provide as safe as possible environment for the children.
I think that's wonderful. So if we can think about at the biggest level, vaccination for the whole community and maintaining things like those masks, social distancing, and public health efforts at the public level. And then at the schools level, knowing that many schools and many teachers are providing a safe environment through, the density limits, the distancing, the checking in or checking out, tracking movement, masks, HEPA filters, and all the other things as well. Those are additional support. And then at the level of the child and the family, I think providing that encouraging place to say, there will never be a time when we would be 100% perfectly safe. There will always be a small amount of risk involved. But if we can lower the risk by multiple different things, then we are providing the best environment for our children to learn and to grow. And I think that's the thing as well. Our children knows that they need routine to grow. They need an activity. They need a routine. They need a repetition and stability for their growth. And I think one of the things that I really also want to say to the group is that as parents and as educators, you have been the one that has been caring and protecting and nurturing them. And so we want to thank you for being that role model. There's an interesting study in medicine and surgery in my area of practice that shows that when a parent is anxious about an operation, the child visibly becomes more anxious about that operation. If teachers and parents are really anxious about COVID, the children will reflect that as well. So in a sense, providing that safe environment, providing that confidence from a parent's point of view and a teacher's point of view will then mirror or reflect that into their children, so the children can see that, oh, mom or dad or teacher so-and-so are confident that we are as safe as we can. And I think they will be able to see that as well. Any last words, Dr. Lim?
I think just to remind parents as well, like we do, it's our natural instinct to want to protect our children from illnesses, but actually they're exposed to lots of viruses all the time. And fortunately for children, actually COVID is really mostly a very mild disease. So even if they do catch it, chances are they're going to be fine, they're going to recover. So don't panic if your child does catch COVID, most likely to be fine.
We'll take that. Of course, we don't want anyone to catch COVID, but at least it's reassuring that the data from Australia and around the world does show that children don't seem to get the really severe disease. So that's reassuring to know. Now, last minute thing for me, the last words from me is just to basically say again, to reiterate, thank you. If you provide an element or a place of safety, your children will feel safe, both physically, mentally, emotionally, and spiritually. So we will try to join you live right now. We will end this discussion here. We will try and join you live. Again, thank you to Astrid for the invitation for Dr. Lim and I to share. And terima kasih sayang. See you later.